There are three things missing in many treatment programs that I see across the country, and it's really limiting you from treating patients for as long as you possibly could. That's medically justified. It's hurting your ability to make an impact on a patient's life to the fullest degree. It's increasing no-shows. It's increasing last-minute cancellations and self-discharging. So it's really hurting you. So I want you to take a look at this training that I did recently. I'm going to share with you just a segment of it that will really help you to see the three missing things in most treatment programs. So enjoy it. Bye. The typical clinic treatment program stops at function. If you look at this list, you'll see that I list pain relief number one. That's what gets patients in the door. You know what I mean? And but what we know what we must do to get them to function is we must increase motion, we must increase strength, and we must reduce stop pain. And we do that pretty well, most of us, and then we get them to function, to be able to do, throw a ball again, play catch with their son, or be able to lift, or be able to walk, or be able to run. And we do that, but the typical clinic program stops at function, meaning we know what we need to do to decrease or stop pain. We know what we need to do to increase motion. We know what we need to do to increase strength. And a lot of times the function just naturally comes as a byproduct. We don't necessarily always make the function come about, because basically what we're talking about for most of us, function is like sitting, standing, walking, running, reaching, pushing, pulling, throwing, lifting, bending, squatting. So a lot of times those basic functions just happen once we do the other three things. But there's something I want you to know about coordination. Now, I want you to write this down, because, and you may not be following me now, but this is all going to make sense to you in just a second. Here, let me shut this up. Is basically coordination is what? It is function. Write this down, function with accuracy. So, and not just accuracy, but it's function with balance. It's function with good form, and it's function with timed adjustment ability. Now, we don't always take a patient there. Now, we may get lucky, and most therapists, I'm talking about therapists in general, may get lucky by doing some things that actually enhances one or two of these things. Accuracy, balance, form, good form, and timing adjustments. But most therapists are not highly equipped to actually do the proper things to get a patient to that level. And most discharge patients after the function is there. And the sixth is agility. Now, basically, and write this down, basically all agility is coordination at a higher speed. And I'm going to explain this in a second, but also number 7 is athleticism. And basically all athleticism is agility with endurance, meaning you can continue that for a longer period of time. And that's what makes athletes. Now, agility, let's go back down to agility for a second, because when you want to improve somebody's agility, there's certain things you have to do. Now, most therapists don't think that agility and athleticism is something that we need to do with most patients. They think that's just for athletes. And a lot of times, coordination is not being properly enhanced in most treatment programs. Now, here's the thing. Here's the reason why coordination, if you heard what I said, which is basically function with accuracy, function with balance, function with good form, and function with timing adjustment. The reason why that's so important if we were to look at it from an insurance standpoint or a medical justification standpoint, is that coordination, if this level is not achieved, re-injury potential is very high. And it's very high due to the faulty mechanics and with the inability to adjust timely to outside forces. So now that sounds like something that only athletes need, but it's not, because this is also for the elderly. You know, their inability to recover from a fall, their inability to adjust properly so that they don't lose their balance is very, very important. Now, let's look at agility. And I'm going to talk a little slow because I want you to be able to write this down. Let's talk about agility. What's the definition of agility? I'm going to quiz you guys as we go, and I'm going to give you a quiz at the end of this. Tell me, what did I say agility is? Who's listening intently? What is agility? And also, I want to make sure that you guys are still with me, because these Wi-Fi connections sometimes can get a little fuzzy. Coordination at higher speed, correct. Now, once again, medical justification. Why is agility important? Well, if this level is not achieved, recovery deficits, their inability to recover from outside forces, which in everyday life there's tons of that, their recovery deficits remain, and falls or accident types of injury potential is also very high, and they end up getting re-injured. So that recovery ability deficit. And once again, how do you take a patient to this level? You know, every common Joe, a senior citizen, is it important to take them to this? Yes, because do you want them to fall? Do you want them to get re-injured? No. Do you want to equip them and empower them with the most prime, most optimal ways so that they can handle life's, unpredictable forces and not get hurt? Now, athleticism. Now, if this level is not achieved, exceeding beyond the normal limit, may result in injury and or an accident. Now, athleticism isn't just reserved for athletes. Every single person needs athleticism in order to work, in order to meet the demands of life. Now, what did I say the definition of athleticism is? Who remembers? What's the definition of athleticism? I'm going to wait for an answer. I want to make sure there's at least one person out there who remembers what athleticism is. It's agility with endurance. Correct. It's the ability. So, for example, if you have somebody who's able to run and cut, and they can do it at a higher speed, so they're beyond coordination, they're at the agility level. The thing that makes them different, I can run and cut too, just as fast as some of these pro athletes. But what do you think's the difference? Is that the pro athletes can do it for 4 days in a row, where me, after 4 minutes, I lose form, I lose quality of movement, I lose strength, everything. So I want you to, once again, and I want to reinforce this, so I want to just basically tell you that, and basically if you want to look at strength is a function is basically strength with ability, and function and coordination is basically function with what? Is basically function with accuracy, balance, good form, and time adjustment abilities. And then agility is basically coordination with speed, and then also athleticism is basically agility with endurance. Now, if you remember this, it's going to make you a much better clinician, because it's going to give you a sequence to follow. And how does this all come into play? Now, can you guys see this? Now, this is, I call it the Life 7 Matrix. Now, this is a program that I've developed. I've been developing for a while now, and I've finalizing it, and I put a name to it. But basically, and I don't know if you can see my little cursor, but here's the reason why I'm talking about this today, because when you take a person from pain relief, motion, and strength, when you take a patient through those levels, you might think you're changing their life in some way, but you're not. There's a lot of people without pain that have motion, full strength, that are not happy, that are not going anywhere in their life. Actually, there's tons of people like that. So don't think that just because you empower somebody with pain relief, motion, and strength, that somehow you're going to change their life. And even if it results into function, all it does is it makes them able. And being able doesn't mean that you're going to have a meaningful, fulfilled life. You exist. You exist at this level. Now, what I've found and what I've researched and what I've experienced is that when you actually start injecting coordination therapies, their confidence begins to come. And that's when happiness begins to flourish. And a person who's dependent on their physical body, it requires them to have function with accuracy, function with balance, function with good form, function with the ability to adjust timely, in order for confidence to start to be. And this is all very much a neurophysiological dynamic. And I don't want to get too technical with you guys, because I'm going to show you in just a moment how to actually inject it tomorrow into your clinic, because it's not as hard as you might think. But confidence begins. Super important if you want to change a person's life, that you understand how do you inject confidence. Now, some of you are like, James, is it possible to change every single person's life? And I'm going to say that yes, it is. But now, will most of you change every single person's life? Probably not, because we have our own deficits and problems. But what I'm saying is, this is not just my opinion or my theory. This is a universal type of law that, and it's directly linked to the physical, and the physical is directly linked to the neurological, emotional, psychological. But so if you can inject coordination, and I'm gonna share with you some simple stuff, but we're going to cover more of this in the MFM class coming up in October. But so those of you who's going to be there at the MFM, let me know if you're going to be there. Super exciting. I'm going to be covering this with you as well. This is going to be part of it, but it's going to be a 3-day intensive boot camp on just movement to change lives. And but now the agility level. So if you go up here to the results column, if you start injecting agility therapy, this is where confidence matures. This is where confidence becomes truly strong and powerful. Now, if you inject athleticism, and just like most athletes, then you get arrogance. This is where arrogance comes into play. Now people start thinking they're invincible and supernatural. But it's why a lot of athletes are arrogant. It's because they have agility with endurance. They have the coordination at high speeds. They have the timed adjustments and good form and balance and accuracy. They have the function. They have the strength. They have the motion. They have the pain relief. They have it all. But we rarely take patients to this. And even those who do sports, who works with athletes, therapists who work with athletes, a lot of the programs I'm seeing, they're not taking them to the athleticism level. They're doing it at the agility level or coordination level even with athletes. So, or even just doing strengthening. But I want you to understand the importance of this matrix. And I'm going to share with you in just a second how to start injecting some of it. But until you start at least breaking through to the coordination and agility level, you're going to be hard pressed to change patients' lives in a way where they say, oh my gosh, I am so confident now. I am no longer depressed. You've changed my life. I can now go dancing where I feel like I look good when I'm dancing. Because you don't want to just take a patient to sit, stand, walk, run, reach, push, pull, throw, lift, bend, squat. That's just mere existence. You want to take them to a level where they can enjoy life confidently. Excuse me. All right, so let me also share with you this. Do you guys want a copy of this matrix? Do you want me to let you get it? Do you guys want this? Hopefully you took notes because you'll better remember it. But do you want this matrix? Let me know. All right. Now, one of the ways that you can inject agility, coordination, you can inject coordination is, and also agility, but I'm going to stay real basic with you guys. One of the ways to apply this concept is basically inject leaning. Now, what happens when somebody, like, let's say that you're having someone just do a basic push-up. I just want you to understand this concept. Let's say you're having someone do a basic push-up, and they're doing push-ups with their feet elevated or not, it doesn't matter. But how do you inject a lean? Anyone do this? Is there anyone doing this with patients right now, or do you understand what I'm saying? How do you inject a lean? Somebody tell me. How do you inject a lean into this exercise or motion? Now, obviously, I don't know if there's a delay, but I'm not getting anyone giving me an answer. Okay, the way you inject a lean, I don't know, not too many want to put yourself out there in case you're wrong, right? Don't worry, this is only us. We're in a closed room, closed environment. No one's going to be judging anybody. I want you guys to just free flow it. But the way you inject the lean is basically shift your center of gravity. Shift your center of gravity within the base of support. Now, if you shift your center of gravity outside the base, peds therapists, any peds therapists here today? Because this is something that I know you guys do all the time, but this is something I want you to understand too, is when you shift your center of gravity within the base of support, but it's super challenging because you start, once you start leaning and transferring that center of gravity to, like, let's say an outside left corner, left upper corner, left lower corner, or you lean to the right, go right upper corner, right lower corner. When you start doing that, it really starts kicking in the nervous system, kinesthetics, and proprioception. This is super important because, so basically what I'm trying to say is this. If you want to add coordination and start doing some coordination therapy, all you have to do is inject some leans. Now, instead of having a patient do push-ups, have them start leaning to one side. Now, they can do 5 normally, and then they do, 3 leans. And then they do 5 normally, 3 leans. So, all in one set. You can just start, depending on the level of the patient. I don't know, what level the patient's at. So let's say this is a shoulder patient, and we're trying to get them to throw. And so I do a lot of this with patients that need to be able to throw. And so I do that. I have them do 5 repetitions. They're doing 20 total, but they do 5 normally. Then they throw in 3 leans. And then, so they're going to all the 4 corners of their base of support. And then they do another 5, and then they do another leaning to all 4. So super important to start injecting coordination therapy. Now, just for the sake of training, let me just go and keep this might be a good sample. So if I do that, then I'm going to start taking them into coordination, even though they can't throw quite yet, because these overlap. Function, 80% you're working on function only, and then at the last 20% you're overlapping with coordination therapy. So now we're doing the leans, we're getting coordination now, but because until they get fully achieve the coordination level, they might be able to throw, but doesn't mean that they can actually throw accurately. So even when they're playing catch with their child, they might be like throwing it all over the place. And if their mechanics are faulty because they don't have good accuracy, balance, and form, and the ability to kinesthetically adjust their movements, they're going to re-injure themselves very quickly. And so they're not going to feel very confident. So until you get that coordination, being able to throw, if you can't throw accurately, what's the point? So it's super important to inject these leans, which is essentially just changing the base of support. Now, let's go to the next one. Are you guys following me so far? I want to make sure you guys are following, because to me, this is super exciting stuff because of the results that I see. As you guys know, I worked with some of the most famous world athletes, and I can't mention all their names, but in order to work with them, it's a little bit, when I first started, I was very nervous, and I was like, I don't know if I know enough, and so I did a lot of research, but over time, a lot of experimentation, learning more and more. And so the results are super powerful, not with just athletes though, because I do it with my everyday Joe, I do it with seniors, and the results are just amazing because their lives will be changed. And it's like, how did I do that? How is it that I can get physicians and patients and athletes saying that their life was changed when I really didn't pull out a Bible? I mean, I didn't do any of that stuff, but they just feel that what we did, that experience, dramatically boosted their motivation level, where they became better as a person. And so anyways, inject leaps. So the first one was inject leans. Now you're going to inject leaps. Now, for example, very quick and easy. You got a back pain patient. You have them doing squats, right? You have them doing mini squats. You're having them doing squats. If you're not, you better, because they need to strengthen their glutes and their quads. But all you have to do is inject leaps. So basically, they do a real gentle leap. So they do 5 repetitions of the squat, but then after 5, they might do 2 or 3 leaps, and then they'll continue with 5 more reps of squats normally, and then do 2 or 3 leaps, or just 1 leap. So because you don't want to irritate their back, but so you got, depending on the level they're at, but you want to inject leaps. Now, leaps are super important. I'm not going to get too much into it because I want to talk about employee training. I'm going to get through everything. But I want you to come to the MFM course in Dallas in October, because we have 3 days to go over this stuff. So you can walk home and you'll feel confident working with, professional athletes, as well as super confident about changing lives with patients in your everyday Joe. So that's just one simple way to do that. Now, for example, another thing I want you to know is that, for example, the traditional balance, training, when you start understanding how this works, this Life 7 program that I'm going over with you, which I'm going to also share with you in the MFM course, you start to realize that a lot of things that we've been doing are just, I don't want to put it down, because I don't want to make you feel bad that if you're still doing some of this stuff, because it's I just want you to know there's a reason why you're on this call. I want you to know there's a better way that has much more profound effect on a patient's physical, but also nervous system, and also in their psyche and emotions. So traditionally, we might have them raise a foot, and then we, see how long they can hold the balance. we might put like a cushion under their foot, so we change the surface area so that it's not stable, and they have to adjust and stuff. But to me, that I used to do that for like 5 years after I graduated, and I never got a lot of results, and a little bit, but not a lot. And I had people with like cerebellar atrophy, with movement issues and balance issues, and it's just a little bit improvement, but not a lot. But now here's the thing. Here's one thing I want to share with you before I move on to training staff. You must change the center of gravity point if you really want to challenge balance. You really want to train balance. So I call this, and this is part of the coordination level as well. I'm not going to be able to go through all levels and show you everything tonight, but you have to move the center of gravity, and that's one of the reasons why I like the leans. But until you move their center of gravity and then challenge, because a lot of times just standing there's a lot of vestibular, there's a lot of visual going on, where you don't have a lot of challenging of the kinesthetics and proprioception as much, because you're not getting much movement, and you're getting a little bit of adjustments from the ankle and the knee and the core. But anyways, without getting too much, you want to move their center of gravity. So really a better way that I've gotten literally 5 times better results is when you have them move their center of gravity, and then you change their vestibular, their visual system outside the base of support. So that's why and that's one of the reasons why yoga is so powerful in making even seniors who the society kind of gives up on, makes them feel like they want to go out and dance, they want to go out and jump and leap and do things again. It's just crazy because when you start injecting this kind of coordination therapy, and especially agility therapy, which I do with my seniors as well, it just changes their life. So, I mean, obviously I can't I wish I could just get up and show you some movements and stuff to help you explain, but hopefully these pictures do it. But, that's one of the reasons why I do the MFM course, because we can't do this online. Can't do the movement-based courses on a webinar. It's just too hard. Much easier. You'll get a lot more out of it if you come face-to-face. So I'll give you guys a link at the end of this to where you can go and sign up for, because we do have a few spots open. We had a couple cancellations due to this hurricane issue in Florida and stuff. Holy cow. Crazy what's going on. So, all right. It's called the Life 7 method to patient care and rehab. I'm going to show you coordination therapy. I'm going to show you agility therapy. I'm going to show you athleticism therapy, or I call it athletic therapy. I'm going to show you these so you can really start changing patient lives from a clinical perspective as well. All right, Lily says, would you charge agility and coordination as neuromuscular? Yeah, whichever code pays the best, whether it be TheraX, whether it be therapeutic activities, whether it be neuromuscular rehab, you could charge any one of those for it, because the whole point of this is to improve function, but it's also a safety issue as well. So if I inject agility therapy, if they say, well, why are you doing agility therapy? They can already, sit, stand, walk, run, reach, push, pull, whatever. I say, well, because I'm concerned about re-injury, because their ability to recover from odd forces might cause them to fall, might cause them to be at high risk for an injury or accident. So, it makes it easier for you to justify what you're doing. Because if the insurance says, no, they can walk now, so let them go, and then the patient, falls and breaks a hip, then they can sue the insurance. So for negligence, because they, canceled their insurance on you. So All right, so let's go to